Let's now bring in the Australian Medical Association President Dr Omar Khorshid, who has obviously been lobbying the government on the health front. Dr Khorshid, appreciate your time. What is it that you'll be looking for in tonight's budget papers? I know you have a long wish list when it comes to healthcare funding. What is the priority?
Well, I think, Ash, this being a budget that is just before a federal election, it's really the opportunity for the government to lay out their vision for Australia's future when it comes to health, their vision for public hospital funding and to improve access and reduce ambulance ramping, their vision for primary health care to keep Australians healthy in the community, not needing those hospitals, their vision for a private health system that's actually sustainable and affordable for all Australians. And although a lot of the talk's been around cost of living, I think quality of life is absolutely critical for Australians, and a really big part of their quality of life is, of course, health. So it is, as you say, a long wish list from the AMA, but at the core of it, we want to see what is the government's vision to take us forward as a country post-pandemic.
So when our viewers listen to the Treasurer's speech tonight and listen to millions being thrown here and billions being thrown there, what context would you like them to have in terms of how much of a catch-up game we're really playing when it comes to health, how much of a logjam there is in our hospitals and how the pandemic has really exacerbated that?
Well, as we've come out the other end of the pandemic and acknowledging that who knows where the pandemic's going, but assuming that we're coming out of it, we're left with a health system in which the cracks have been widened by the pandemic. Access has been found to be inadequate for people with COVID and people with non-COVID conditions. We've got an extra 200,000 people on elective surgical waiting lists than we had before the pandemic. And of course, we have those underlying issues that we've been talking about for so long, the ageing of the population, the increasing levels of chronic disease, and all of these things are snowballing in terms of future demand, with increasing the pressure on hospitals that are jammed up right now, not even looking into the future. So any government that is serious about health has to tackle this problem of public hospitals, has to tackle the root causes, which include improving the quality and access to primary care, and looking at keeping Australians as healthy as possible in their homes and outside of our healthcare institutions.
So away from that hospital funding, I know on that wish list that I mentioned, you've been pushing for a tax on sugary soft drinks. This is something I know from interviewing you in the past that the AMA has been backing for a while and sees as a no-brainer. Are you getting any indication the government will be taking that advice?
Very little indication at all that government's taking our advice on a tax on sugar-sweetened beverages, and of course this is a no-brainer because it's a win-win-win. There are no losers from such a tax. The government raises money. People who are using too much of these products will actually save money, and in saving money they also improve their health. Of course, future health costs down the track are saved through reductions in obesity and diabetes, and we've seen this all over the world. So our position on a sugar-sweetened beverage tax is just one of our four main platforms that we've taken to government. We've suggested them formally. We've actually done costed analyses of each of our proposals on hospitals, on private healthcare, on general practice, and on this tax. So this is not pie-in-the-sky proposals from the AMA. These are economist-costed suggestions that we think will go a very long way to delivering a vision, I guess, for Australia's health, which is what we really haven't seen from successive governments for a long time now.
Dr Khorshid, a few moments ago when you were talking about getting out of the pandemic, you did sound a little bit doubtful. What is your sense of how well prepared we are to take on COVID as we do edge closer to those winter months? Would you like to see restrictions reinstated in states that have wound them back, or are we on the right track?
Well, if it remains the case that the BA2 variant is as mild, I guess, in a vaccinated population as BA1 was, then the virus itself may not cause catastrophic extra demand on our hospitals. But of course, it doesn't take extra demand on hospitals for them to struggle. And we've seen through multiple years, every winter, we see hospitals unable to meet demand. And this year we'll be facing both COVID in the community and the extra demand from that, probably a substantial flu season as well as flu vaccine rates go down. People have been so focused on COVID, a lot of people have forgotten about the flu vaccine. So we're really worried about winter, and I think all governments, state and federal, share that worry. And that's just yet another reason why we have to take the health of our health system very seriously. We've got to increase that capacity so we've got some spare. And in the short term, in terms of the pandemic, we need to be ready to take whatever measures are necessary to protect Australians' health. Now, hopefully that won't mean masks and lockdowns and things again, but this pandemic has thrown up curveballs time and time again, and it's absolutely critical that we remain prepared, we remain vigilant, because the stakes couldn't be higher.